Maybe on average about 30 minutes of warning we'll be able to give people. That's really important because that's enough time to take perhaps a medication. If you've got a VNS or a DBS system, you might be able to swipe a magnet, increase your stimulation. Maybe you could prevent the seizure. Certainly enough time to call someone you love and say, hey, can you just stay with me, make sure I'm okay.
Hello Homo sapiens. Welcome back to Epilepsy Sparks Insights. Today is part 2 of 2 with the fabulous Ben Brinkmann, a clinical support scientist, amongst many other things, at the Mayo Clinic, who shares with us his latest in seizure forecasting and remote monitoring technologies, their accuracies, and plans and hopes for the future. A quick one, please don't forget to like, comment and subscribe because your comment and like will help spread awareness and understanding of the epilepsies around the world. Now on to our start of the week, or the past 2 weeks, Ben Brinkmann.
I'm a clinical support scientist with the epilepsy group at the Mayo Clinic. I do a bit of work with mostly our patients who are going towards surgery. These are the people who medications haven't worked for.
Seizure forecasting is something that is, another passion of yours that you're very involved with, I understand charities as well as for-profit organisations and getting everybody together to contribute. Can you just give us a quick insight into what you're doing there, please?
One of the things about epilepsy that really makes it a challenge is, of course, people have seizures rarely. It's really difficult to have someone in the office have their seizure so you can observe it. And typically we bring people into the hospital and it's not much fun. They're stuck there for a week or however long. So I've been really interested in these remote monitoring technologies, whether it's EEG, whether it's wearable devices, and I think there's an immense amount of promise there. We've done quite a bit of research with non-invasive wearables. There are new devices, the subcutaneous EEG devices. It's just a small electrode that goes under the skin over the skull. Very, very safe to implant, and it's like having a very limited coverage scalp EEG system in place for a year. You can monitor someone for a year, and you can someone who has 5 seizures a year, you can capture all their seizures, and then that information is so incredibly valuable. The other thing, of course, as you mentioned, that's all build up to your question, seizure forecasting. We found over the years through a couple of research systems and a company that nearly made it in the United States, but it was a startup company, and they just couldn't get through the regulatory process. But these sorts of ambulatory recorders with invasive electrodes, we've been able to record people's seizures over like as I described, a year, maybe more. And we found that with that kind of long-term data, you can start running machine learning AI models on the data, pull out different characteristics of the data. And what we find is that there are very, very subtle changes to the EEG before seizures. And different groups have studied it differently, but we think 60 to 90 minutes is probably a good time frame before a seizure to look. Everybody's a little bit different, and it depends on the person. But looking at those changes before a seizure, you're able to make a forecast of a seizure. You're able to forecast people's seizures. It's a bit like forecasting the weather. Sometimes you get it wrong. Sometimes you rain. The weatherman says it's going to be sunny and it rains. But you're right more often than you're wrong. So that tells us there's a signal there. It isn't perfect. If we keep working, we'll continue to make it better and better.
Mm-hmm.
So we've extended that work to we're working with subscalp EEG now. We've got some evidence that we can do seizure forecasting with subscalp EEG, and we were able to do a bit of seizure forecasting with the wearables. We think we need to do much more work there to make it more accurate. So people, it's clear there's a signal, but that can still mean that if we tried to launch a system, it would be frustrating for people because we'd be missing seizures and they'd be getting false alarms. We're still better than random. So we do think this is worth pursuing, and we are pursuing it.
And what sort of time scale are we looking at, do you reckon? I mean, it's probably really awful question, but what would you foresee in the next 5 years, for instance, where the algorithms are going to be much cooler and we're just going to really see we're going to be able to predict seizures more accurately, do you think?
It's a great question. Our data suggests that maybe on average about 30 minutes of warning we'll be able to give people. And of course, that's really important because that's enough time to take perhaps a medication. If you've got a VNS or a DBS system, you might be able to swipe a magnet, increase your stimulation. Maybe you could prevent the seizure. Certainly enough time to call someone you love and say, hey, can you just stay with me, make sure I'm okay.
Or if you're at work, for instance, you say, oh God, this is going to happen. All right, cool. I'll go and, the medical room or whatever, or I'll tell my colleagues where I'm going to go, what's going to happen, why I'm not going to be there, And gosh, that could be horrifically empowering. And when we're talking about, though, accuracy in seizure prediction, this is, as you previously mentioned, this is the bit of an issue at the moment. And it's actually, from my personal experience speaking to people, it's one of the key things that really annoys people is that they might get an alarm and it's not going to happen.
Yeah.
And that can stop people from actually using seizure forecasting devices if it's not an implant. So where do you think we are? How accurate do you think in, say, 5 years' time these devices are going to be in predicting seizures?
I think we'll continue to get better. I think we can get to say maybe 90% accuracy. So we'll miss a few seizures and we'll give you a few false alarms. But of course, I think one of the great ways forward is to pair it with a therapy or something that you can do. And in those cases, you'll be able to intervene. And if I guess if you, for example, a false alarm, if you have a warning and you take a medicine, did the medicine work or was it a false alarm? Maybe you don't care because you didn't have a seizure and you're happy about that.
Yeah.
The other thing about the time frame, which is really important, there's new evidence that's coming out, and this is work that's been done by our friends in Australia and Switzerland and San Francisco, but looking over very, very long time periods, seizures are cyclical. So, you might be able to look at your seizure pattern and your EEG pattern and your pattern with wearables. That was something we looked at and found that for many people it was true. And that's really empowering because that might be able to tell you, okay, your seizure cycle is around 11 days. So, you had a seizure 11 days from now, you're probably at high seizure risk. So, we wouldn't say it's an alarm and you need to, maybe you take a medication, obviously talking to your physician, of course, or have some intervention, but you might just say, gosh, I'm going to work from home that day.
Or I'm not going to go out on the lash, go to a party. I'm actually going to stay at home, chill out, watch some really, really bad Netflix or Amazon Prime or whatever.
Exactly.
And have a nice glass of, mineral water and chill, rather than putting yourself at risk, maybe.
Absolutely. And those kinds of things people can do. And it's no risk to modifying your activities and just being more careful on certain days. So it's really, really a promising technology.
And this is something you have to keep us all up to date with, Ben, because it's really exciting stuff. And I love your honesty as well. You're not saying, okay, darlings, tomorrow we're going to have something that predicts 100% of your potential seizures. Life is perfect. That's not going to happen. But we very, very much appreciate you being, frank with us. Nothing's 100%. But this is how it can, where we're likely to be and how these things can potentially improve quality of life by giving people, more control over their lives, I guess, especially if an alarm is, 30 minutes prior to a seizure. That's amazing.
Absolutely. And as a scientist, we're wrong as often as we're right. So it breeds humility. And I think, I'm glad, I really want that people to hear that message too. Don't think that because your seizure forecaster, whatever device you have, tells you that you're at low risk, that you should get in your car and drive or do something that's unsafe because we're not that good. The technology's not that good. Will it ever be that good? Gosh, I hope so. I just don't know, though. I really don't know.
Thank you to Ben for his honesty and humility as a scientist. This is sometimes not valued enough. Do keep your eye on Ben for his developments in AI, machine learning, and the benefits to people affected by the epilepsies. Do also check out his profile on TorieRobinson.com, where you can also find the transcription of today's episode. Again, if you haven't already, don't forget to like, comment, and subscribe, and see you next time.